So one of the questions people have as well, if we have these cells in our body, why is it that they don't already kill the tumor? Tumors develop very slowly and actually very rarely, given the trillions of cells that we have in our body. And as they develop, they build shields to protect them from the immune system. And what happens is they figure out what are the stop signs on the normal immune cells, and they figure out how to hit those stop signs that suppress the normal immune cells from recognizing them and responding to them. These are called checkpoints. So normally your immune cells have checkpoints on them so they don't attack you. And that's very important to prevent autoimmune disease. But tumors figure out how to lock into those checkpoints. And so the immune cell, such as a natural killer cell or the T cell, thinks it's seeing you and it's being told to die down its attack by the tumor cell engaging with the checkpoint on the immune cell. There's been a revolution in the development of checkpoint inhibitors, largely monoclonal antibodies, which can be infused into the patient, blocking that interaction between the tumor and the immune cell so that the immune cell is not told to dampen down or suppress, but to go ahead and attack. So arming a natural killer cell, which naturally is ready to kill a tumor, with a chimeric antigen receptor and blocking the tumor's ability to engage the natural killer cells checkpoints will add, in the laboratory has and should in the clinic, add additional power with that anti-tumor effect of the natural killer cell. So there's early clinical evidence that natural killer cell therapy will be effective in the treatment of blood cancers such as lymphoma. One of the holy grails, of course, is the much more common solid tumors, such as melanoma, lung cancer, pancreatic cancer, traditionally very difficult tumors to treat with immune therapy. But there's early indication and some longstanding indication that one immune cell, the T cell, can have efficacy against solid tumors. And the natural killer cell is very much like the T cell in that it has potent ability to kill tumors once it's able to recognize them, to see them, and then engage with the tumor itself. And there have been several developments over the last several years that are very encouraging for the use of natural killer cells, like the use of T cells, in the treatment of solid tumors. Number one, as I've mentioned, chimeric antigen receptors. Chimeric antigen receptors are the eyes. So natural killer cells in the body have difficulty recognizing the tumor, which can camouflage itself to look normal. But putting a chimeric antigen receptor on the surface of a natural killer cell, which now can be done, you're giving the natural killer cell a set of eyes to find the tumor. Second, we talked about checkpoint inhibitors. That is, tumors figure out how to dampen the immune response of T cells or natural killer cells, and we can infuse antibodies which reverse that effect. And third, perhaps most importantly, is when you're making lots of natural killer cells in the laboratory to infuse into patients, they need a gasoline of sorts to keep running in the body. And there isn't enough of that gasoline in the body when you're infusing lots and lots of NK cells into the body. And so we now have the ability to insert a gene which allows those natural killer cells to make their own gasoline. So every single natural killer cell of the millions that you would inject into a patient will have its own supply of that fuel, which will keep it alive for days, weeks, and even months. Those are some things that are happening right now in the laboratory and actually in the clinic, which give me hope that we'll be able to crack the code to allow immune cells such as natural killer cells to become much more effective in the treatment of solid tumors.